March of Dimes is leading the effort to impact birth equity across the nation, understanding and recognizing that it takes an entire community to have an impact. And that's where the collective impact efforts start to play a role.
We're so excited. This is a March of Dimes national effort, and we're just so proud to be hopefully the model city here in Houston, Texas.
We have to work on a lot of things at the same time. We need to improve outcomes in hospitals and with physicians. We need to make sure that other systemic challenges don't stand in the way of women being able to receive great care before and during and even after pregnancy.
I know how many women are served, and I know how much it means to women to get access to the kind of education that they need to have a healthy pregnancy and then to be a good mother once their child is born. March of Dimes does all of these things, and they do it better than anybody else. I was very motivated to try and see what I could do to be a part of the solution to this problem.
I think that historically we've really focused on the health of the newborn, and we've addressed prematurity, and we have a lot of services wrapped around the baby. I think it startled many of us to put our heads up and look to see that mom's health wasn't where we wanted it to be.
A lot of folks in Houston are surprised when they hear the statistics. We're a proud city. We do a lot of things really well. So when we hear that we have a problem of this magnitude in our city, folks really want to get organized and rally around it to help move the needle.
When they took Kira back to the OR and they opened her up, there were 3.5 liters of blood in her abdomen, from where she had been allowed to bleed internally for almost 10 hours. While our begs and our pleas fell on deaf ears. After telling me that everything would be fine, when those doors opened and closed behind my wife, that was the last time I saw her alive. Kira deserves so much better.
These challenges across the country are affecting almost every single community. Policy change is at the heart of what will make a big difference. That's why Charles and I spent time on the Hill.
We want to make sure that we understand local data, and that we utilize that data to impact evidence-driven policies.
This work that this organization is doing is generational defining work. Because this work, to send a loud, definitive message to this country that mothers and babies matter, is not only going to affect this generation, but generations yet born.
Welcome, everybody. Welcome. I'm so excited to be here with you on today. My name is Sky Houston. I'm an on-air personality with KMJQ FM right here in Houston, Texas, and we're kicking it off. Proud to be here with March of Dimes, for it starts with mom. Now, let me tell you guys, last year, I was a part of this amazing panel, and I'm so proud of what the March of Dimes continues to do. I'm going to go ahead and bring in our first panelist for today. She's an amazing woman. I learn something new from her every single time she graces the stage. Today, she's gracing it with us virtually today. I want to go ahead and welcome in Miss Stacy D. Stewart, President and CEO of the March of Dimes. Stacy, are you there?
I'm here. It's great to see you, Sky. Thanks for being here and hosting today.
Thank you so much. Thank you so much. Now, Stacy, I'm excited. I know the conversations we had last year, and I know what we as moms faced when it comes to getting the care we need, when it comes to being heard. Tell me, over this past year, what has changed? Tell me where we are as it stands with the March of Dimes.
Well, first of all, I'm really pleased to be here and to be at this point, 1 year out from a fantastic event that we had in Houston last year to really launch our birth equity efforts down in Houston. This is really important work for the March of Dimes. As everyone knows, we are really focused on eliminating preventable maternal death and infant death, especially around premature birth and all the contributors to maternal mortality and morbidity. These are big challenges in this country, and especially in Texas and even in the Houston area. And one of the things that we've seen, obviously, is the fact that we don't think we'll see substantial progress in addressing the maternal infant health crisis unless and until we deal with the issues that exist, especially in communities of color. In places like in Houston, where Black and brown women are dying at much higher rates as a result of pregnancy and childbirth as compared to other women. These are real challenges that exist all throughout the Houston area. But with our kickoff last year, I'm really proud of the fact that we have gotten off to a really great start. We certainly built the awareness and the attention of a lot of stakeholders and partners and community members in Houston around this issue. A lot of people don't even know and understand the kind of maternal and infant health crisis that we're facing all around the country, and especially right in Houston. We've also launched other real efforts to really get care to women where they are and where they live. So for example, with HEB's amazing support, we were able to launch in Houston 4 supportive pregnancy, group prenatal care programs to make sure that women can have successful pregnancies, have the support they need to support them through their pregnancy and beyond. These are really important steps. Obviously, there's so much more work we have to do, but I think one of the things that is really exciting is that in Houston, as usual, is setting a standard for addressing what's really important to the citizens and to the moms, to the families, the babies in Houston and the whole Houston area. And we just know that the next year is going to be even bigger and better with the support of so many folks that are listening today.
I love it. I love the March of Dimes mission. And I love the fact that you guys went out on a limb to say, listen, moms are important, babies are important, but it starts with mothers. We are mothers first. I know we go out on in our careers, we go out fighting in the landscape of what's happening in society, but we're moms first. It starts with us. I want to go ahead and bring on to the panel today a few ladies who know hard work and who know what's important, and putting mom first matters. Another thing I love about the March of Dimes is the effort in going out and making sure it's not just moms amongst moms having the conversation. We're bringing in brands, bringing in companies to share in the responsibility and the awareness. So I'd love to bring on our first panelist for today, Ms. Regina Jones. She is the Chief Legal Officer with Baker Hughes. Regina, are you there?
Yes, I absolutely am, Sky.
Welcome. Tell us a little bit about what you do. When you have your worker hat on with Baker Hughes, what is it that you do?
So first of all, thank you for the opportunity. And I could not think of a better place to be here today than with March of Dimes on World Prematurity Day. In my current role with Baker Hughes, I'm the Chief Legal Officer. And I have been with Baker Hughes for a little under 6 months, entirely during COVID. So it's been a very different experience for me engaging virtually in almost every forum. But I have a long history with March of Dimes. I absolutely hold the March of Dimes near and dear to my heart and my family's heart, because it's been a journey. We have 2 teenage boys, 16 and 17, and both of them were born when I was volunteering with March of Dimes, but didn't really resonate to me kind of what the real mission of March of Dimes was, because I was very young, and it was, hey, you want to participate in a walk, you want to do cool things and meet lots of people, but then it really resonates when now you're touched directly with prematurity. And being a mom, like you said, it starts with you first. You introduce yourself and to a world that can be very isolating. So it's nice to be here with each of you right now, and it was nice to have the March of Dimes back 17 years ago when we had our first son.
I love it. And that's why I mentioned your vocation hat first, because we are super women in the office. We're super women, but we really get down to the nitty gritty and fight harder when we're moms and can relate. So we're going to talk a little bit more about your story, your sons, and your journey along. So just hold tight with us. I'm going to bring one more panelist on with us for today. I'd like to welcome next Stephanie Childs, Vice President of Global Government Relations over at Kimberly-Clark Corporation. Stephanie, are you there?
I am, Sky. Thank you so much for the opportunity today. I appreciate it.
Go ahead and tell us, what do you do when you have your Superwoman cape on at work?
My current role is Vice President for Global Government Relations at Kimberly-Clark, and many of you are probably familiar with Kimberly-Clark's products, things like Kleenex tissues, Cottonelle bath tissue, and really relevant for this conversation, Huggies diapers and baby wipes. So we are directly connected to the fight for maternal health and for equity in terms of healthcare services for women. And my job is really, I'm the chief lobbyist for the company. I work with global governments to really advocate for policies that support moms. And I'm fortunate to be backed by a really strong and progressive leadership team at the company that really supports the work that we're doing. So I was, I've been at Kimberly Clark for about 2 years, and really wanted to go headlong into these issues. And so did some research, learned that March of Dimes is really leading the way, and reached out to Stacy through a mutual friend, and plan on doing some really great work in the advocacy area on this going forward.
Absolutely wonderful. I love it. Ladies, go ahead. What were you about to say?
Oh, I was just going to say, and as a personal matter, I did leave out the fact that I'm the proud single mom of 2 kids that were born at 32 weeks, which makes this extremely personal for me.
Absolutely. We are so happy to have you here. And we're going to share more of your story as well as it relates to your children. Guys, you heard them mention the brands that they work for, the companies that they are behind. But one thing that stands out to me is their hearts for wanting to get to the heart of the matter when it comes to birth equity, as it comes to Black moms. And we're going to dig deeper into that today. I'd like to take a second. There's so many brands and companies who understand the value of what March of Dimes is doing and who are on board with that. Turn with me if you would. You're watching at home, you're watching at work with us on Facebook. I would love for you to turn your attention really quickly to a short video from our sponsor, the Houston Public Media Source. Check this out. This is going to blow your mind.
Despite calling my doctor and saying, I feel like something's wrong, I feel like there needs to be more done, I was kind of just told nature does its thing and you kind of just have to wait on it. My name is Deborah Mouton, and I am the former poet laureate for the city of Houston. I'm a teacher and a writer, and I live here in Houston, Texas. I found myself after a miscarriage kind of going into a really dangerous pregnancy. Until about 9 weeks in, I started to hemorrhage massively with my son, and I assumed it was another miscarriage. When I first came in to the hospital to kind of see what was going on after the bleeding started, and they ran some tests and looked at a sonogram, there was definitely a heartbeat. They saw that there was a pregnancy that was in process, but just assumed, the worst, and basically told me to go home and wait for my child to kind of fall out of my body. And so when I went in for my final visit, and the nurses were ready to console me. They came in holding my hands and apologizing, and I remember laying there and the nurses rubbing the cream on my stomach and kind of having these really weird looks on their faces. And then before I knew it, more and more nurses were coming in the room. When they finally saw that my son had a strong and brilliant heartbeat, I just remember wailing, right? At the idea that my child had been there the whole time and that no one wanted to acknowledge that he was there. And that they even offered me a DNC to kind of start over again, right? Not knowing that my child had been there the whole time, that he turned into a very healthy, loving child, and that I would have abandoned the thought of him because people were kind of in a rush to move on to the next person.
We believe that implicit bias plays a role in maternal mortality and morbidities because we see differences in health outcomes that are not explained by socioeconomic status, education, where a person lives, and we see worse outcomes in Black women in particular.
I think other women really have to understand that it is our power to control a lot of what happens to us. A lot of what happened to me wasn't a malicious act, right? It was a larger system and a larger symptom of a system that's been set up to move through people. There has been kind of this rallying cry around specifically Black women in this situation to say, have doctors notate, when they deny you care. I think as a Black woman, everything around us says that we're loud, that we're harsh and brash, and we don't want to fulfill a stereotype. I think sometimes we just need to put our foot down and say, this is what I want or don't want for my child and for my own body, and those things need to be respected. And if that means that we're, a stereotype for the sake of the care of our children, then we're going to need to do what we need to do to make sure that those children get to this world safely.
Wow. I can't tell you guys, while watching that video, how much I felt like she is me. I am her. I felt unheard, and I always thought it was only myself who didn't feel heard. And I'm gonna tell you guys, I speak for a living. I'm no stranger to using my voice, but I try to back off sometimes. I can remember being in the hospital, getting rushed into a C-section. My son was premature as well, getting rushed into an emergency C-section because his head was swelling and feeling all of the pain, but felt afraid at first to tell somebody, to tell the nurse, hey, I don't know if this is right. I feel this. I didn't want to come across as the loud or angry Black woman, but I felt myself feeling like she's not hearing me. She keeps telling me, you're okay, you're okay. I'm going to throw this to Regina first. Have you ever experienced a time when you felt during your pregnancy or even post that you were not heard?
So thank you, Sky. I struggle with that question because I'd almost flip it and say it's easier for me to figure out a time when I might have been heard versus not heard, because there were so far and few in between, if you will. It never really resonated that I felt heard. I was and you're in your most vulnerable, sensitive time when you're dealing with potentially the livelihood of your child or yourself. And so you don't want to be too aggressive because you want to trust that the doctors know, and that you don't want to feel high maintenance, if you will, overly sensitive. But I never really felt sincerely heard. And one of the nurses told me once that you have to be your own advocate. And I think that was the most powerful statement that was ever made to me, because in their busy lives, they're, I guess, used to hearing about people's issues, but they're real when they're yours and when they're dealing with your child. And so I had to, and my husband had to learn to step up and not trust anyone coming back saying, you're fine, but just reciprocating over and over the restatement of your pain or your issue was the only way to actually be heard. And I was never sure if it was just because of annoyance at that point or legitimate, care and concern. You never really know.
Whatever it takes, annoyance or whatever it takes, by any means necessary. Thank you. I hear you when you say you never felt heard. And I'm sure there's a lot of women viewing this now who can say, I relate to that. Or Sky, I'm like you, where I kept using my voice. And although it came across as super aggressive or loud or annoying, it worked for me. I'm glad I did. Stephanie, how about you? Can you relate to not being heard, or what was your experience?
Well, interestingly, I was heard. I had one of my OBGYN was actually a Black female doctor who's one of the best in the area. And I had eaten a big meal. I was in my third trimester. I'd eaten a really big meal, and I was taking a nap after the meal, and I noticed that my baby wasn't moving. I was at 32 weeks, and I knew from reading the books that, the baby should have been flipping around. And so I called the doctor's office, and she had me come in right away, ran some tests, and then had me admitted to the hospital after that. And that was really the call that probably saved my daughter's life. But what I realized was that, they still couldn't tell me why this had happened. I had an unremarkable pregnancy. I had no morning sickness, no cramping, nothing. They still couldn't give me any reason how this happened. To this day, I've never been given a real, solid diagnosis. So to me, it told me two things. Was, the first thing is you've got to be your own best advocate, as you all have mentioned. That call probably saved my daughter's life. And the second piece is just that, there's just such a need for research and knowledge in this area. It has been an overlooked area. And many Black women, are the sole breadwinners. I know I am. We have a high level of stress in our lives. We have a lot on our plates. It's important for us to have a body of knowledge that's dedicated to our situations, so that we can get answers and make good decisions for ourselves.
Stephanie, I'm glad you brought that up, that your doctor was an African-American woman, so she could relate instantly, I'm assuming, or hoping that helped you in your situation. My doctor as well was an African-American woman. And when I think about it, it wasn't while my doctor was in the room that I had the issue. It was when she was away, and it was someone else who wasn't an African-American woman or Black woman who perhaps didn't think that I really needed as much as my mouth was saying. I'm laying there. She believes she did the job. And I'll just share a little bit. My epidural did not work. I felt all the pain as they were rushing me into surgery to get cut. Like, lady, I am feeling this pain. And she kept saying, you shouldn't be, you're fine. You shouldn't be feeling anything. And that's the worst feeling ever, for you to say to someone, I feel this pain. And I don't know if she had children at that time and knew that amount of pain, but to keep saying it, and she just bypassed it. And later on, we're going to talk about some biases, but I want to throw it to Stacy really quickly. What would you advise other women, other moms to do to be heard when you simply are saying it and it's going on deaf ears? What would you give them to do?
Take myself off mute here. It's a great question. And I think it is kind of fascinating that the experiences of being with an African-American healthcare provider can differ than when Black women are treated by other providers. And I think it points to this issue that the video really pulls out, which is this idea of implicit bias, that we do need all women, especially women of color, to understand how to advocate for themselves, or even more importantly, not only advocate for themselves, but to have an advocate with them, right? Mm-hmm. So how do we really expand care so that doulas and midwives can be with the mom and with the partner in labor and delivery, so that there's more than just the mother as her own advocate, which sometimes she may not be in a condition to even advocate well for herself. She may be in pain, she may be in distress, and she may need somebody else with her. So that's one of the things that we're thinking about, is how do we ensure that women don't have to go this alone, especially women of color, especially working women, and especially how can we do it for low-income women where they may not have the resources that wealthier women have to self-pay for a doula or a midwife, right? That's the kind of care every woman needs, irrespective of income or where they live or what race or ethnicity they are. So I think one is, how can we train, help build the awareness, women to be advocates? How can we ensure that there are a system of advocates available to women? But then I think it goes further, because we put too much of the responsibility on women. They have to deal with their own health when they are in a facility or in a place or with a provider whose job it is to care for that woman and that baby. It is their job. So where is the breakdown happening? That's part of why at the March of Dimes we've been so focused on how can we deal with some of what we see in the system and we think is contributing to, and we know is contributing to, a lot of the disparate outcomes that women of color face, which is around implicit bias. How can we make sure that any provider, whether they're interacting with a woman that looks like them or a woman that doesn't look like them, whether they're interacting with a woman that's from another part of town where they don't know that part of town that well, how can we make sure that any implicit bias that may exist within any healthcare system or with any individual provider, and not just the doctors, the nurses, sometimes what I'm talking about are even the front desk receptionists, how can we train anyone in the healthcare system to recognize that they may have implicit bias? By the way, all of us do. All of us have implicit bias about something. We're all human beings. But how do we make sure that we're doing it, and this is what we're working on at the March of Dimes, how do we make sure that we're putting in place the right training, the right kinds of ability for healthcare providers or anyone in the healthcare system to recognize that implicit bias and to ensure that it does not interfere with high quality care being provided to any woman at any time for any reason, to recognize any symptom, to respond to it in a timely manner, because you never know, it could be a matter of life and death. And often it is a matter of death if it's not dealt with in the appropriate way by the healthcare system, especially death among women of color, babies of color, and moms either during pregnancy or even after pregnancy.
Now, Stacy, I'm glad you mentioned the trainings. We're going to talk more, and I want to get your insight a bit more on trainings and implicit bias and what can be done about it. But really quickly, I want to throw it back to Regina and Stephanie. You two work at large corporations, right? Big brands. What can big brands and big companies do to help moms? And is there room for companies to advocate for moms?
So I'll comment on that. I think, first of all, it's super important that in big companies, we recognize that moms, regardless of the level of your organization, it's a part of their lives. We grow up at some point in the company, and at some point we have children. And it's about, one, educating. Secondly, supporting organizations like the March of Dimes, which helps educate throughout the pregnancy process, the maternity process, but also helps educate them on how do you make sure you're living a healthy lifestyle and taking care of your children, as in addition to how do you deal with challenges, and providing that support, whether it's as an employer, as a supervisor, as another woman in the workplace, to make sure that we're helping to improve the cycle, quite frankly, so that this doesn't happen. It's not something that you should have to learn to deal with. And the more companies, meaning because you weren't heard or because you heard a loss, you don't want to recycle stories of after the fact failures in the system or flaws. You actually want to play a proactive role to make sure your employees, make sure your other professionals on your team have the knowledge and understanding that they need in order to ensure a healthy pregnancy. And whether you're in a corporate setting or whether you're in a healthcare environment or whether you're in nonprofit, it really is about equipping our employees and our moms to be able to make good decisions, and also to be able to recognize when they might have whatever baggage they bring to the table, whether it's biases or lack of understanding, that they learn that that's not okay. You've got to be proactive and deal with it yourself so that you can be a part of the solution versus a part of the problem.
Absolutely. Stephanie?
I really think there's strength in numbers. I mean, know what your company's policies are, and if there's shortcomings or things that need to be improved or changed, bring them to the attention of the leaders. I also think, there's clear things like providing family leave and allowing a safe place for breastfeeding or pumping. One of the things that I experienced being a single mom was what I call the single mom tax, which is, I obviously had to travel to move up in my job and be successful. And so, when I traveled, I had to hire, very high quality childcare. Childcare, because, I had to have somebody manage the house and the kids while I was gone. And I call it the single mom tax because it was a non-reimbursable cost that I had to incur that other people didn't. And so there are other things like that, that companies can step in and help with, that are very real for moms. There are, other costs that go along with being a mom. And also, I just think that as a broader question, U.S. companies are hiring more and more women now. And so we all have a stake in using our platform to advocate for things that are good for moms. And most companies do have advocacy organizations like mine that do weigh in on healthcare issues. And I think, asking for your company to get more active with organizations like the March of Dimes is also something that you could do.
I love it. And I love that Stephanie said the single mom tax. And I'm going to add a tax on top of that tax and call it the Black Moms tax, because I want to get back to what Stacy mentioned about a lot of times there are implicit bias that they don't even realize it. So my question, I'll throw this to Regina and anyone who wants to address it. How do you make someone, Regina said, it's not just the big companies, individuals. How do you bring it to someone's attention? And then where do you go from there? Feel free, ladies, anyone could jump in on this because I'm sure you all can give your thoughts.
Yeah,
Regina, do you want to go?
My initial thought is you have to be intentional about it. And it's hard for me to kind of frame up an answer because you would hope that people would recognize in our current environment, if at no other time, to recognize that everyone comes to the table with certain perceptions, okay? And we have to be bold and beyond those perceptions and intentional about making sure that we are stepping up and supporting women, regardless of where they are in the level of the organization. Because a comment Stacy made resonated with me, which is, okay, we have resources, the women on this call, but some women don't have the same depth of resources that we do. And if they're not listening, if we can't get people to listen to us, how do we think that they're going to get someone to listen to them when they're not at the same level of income or whatever? And it's coming to the table and recognizing that we have a responsibility to step up and recognize now where we may have opportunities for us to be better and where we need to bring others along with us, because sometimes others may not have a clear understanding that, hey, my behavior, whether intentional or not, is having an impact that may be negative and creating a problem for someone else. And I'll close this by saying one thing, because when you were talking about having a voice, it also made me think about the fact that, I would have an 18-year-old right now had I been heard when I went into premature labor. And I was told repeatedly that, no, these are just normal pains that you have when you're pregnant. And then it was too late by the time I was finally heard. And so it matters. It's not just people feeling a certain way about, oh, I need to be better in this space. It's the recognition that I will never forget Charles's name from the video. He lost his wife because people didn't listen. So it's a real situation, and we have to be intentional about making that change and being a part of it.
So Stacy, thank you, Regina. You're right. And I love that you brought up Charles. I sat in that room with Charles last year, and the passion that he has for his purpose today in honor of his wife is second to none. And Charles is one of those people who was doing something actively nationwide year round to bring awareness. But Stacy, if I'm someone just watching the stream right now, I don't work at a big company. I may or may not have experienced some of the things that myself, Regina, and Stephanie are talking about. So how do I make my company, myself, my community aware of this? What can I do? What can anybody do at any level outside of what Regina brought?
Well, I think it starts with a lot of what we're doing right now, which is continuing to educate people about the inequities that we see with respect to moms and babies, and helping people understand why they exist. I mean, I think one of the things that people don't understand is how much implicit bias and potentially even discrimination really do impact people's lives and really result in these kinds of inequities that we see. When we look at the fact that a Black woman with a college degree is still 5 times more likely to die as a result of pregnancy and childbirth as compared to another white woman with a college degree, it just in and of itself explains that these aren't issues around education level or income or access to resources. I mean, you can almost compare 2 women with the same, that are essentially the same on all those respects, but the difference is that one's a woman of color and one is not. And that's how we have to actually just really be willing to acknowledge, as leaders, as corporate leaders, as big employers, as leaders of healthcare institutions, that maybe this fight is something that's bigger than the individual woman herself, that maybe there's something more systemic going on in our communities. Maybe there's something, being willing to say, hey, as a leader, as a CEO of a company, I don't know necessarily what all the solutions are, but I'm willing to say that I will put forth whatever I need to with my company to make a difference. And I think women advocating for that in the workplace, at the voting booth, wherever you are, and lifting those voices is really the first step. And of course, educating people along the way. I'm really proud of the fact that companies in Houston and in Texas have really stepped up to do exactly this. So we have Cigna and Blue Cross Blue Shield of Texas and Memorial Hermann Hospital System, who've all said, we want to be leaders in this space, and we want to be a part of the solution, not continue to be a part of the problem or be a part of the problem in any way. And we're really proud of them for taking on that leadership role and for stepping up and serving as a model for others. And I think that comes because a lot of us, the March Times and our partners and women individually, have said, we want to work on this, and we don't find it acceptable that women of color are facing these kinds of inequities. How can we come together as a community to do something about it? And that's what we're starting to see now with this birth equity effort that we are spearheading, but certainly with the help of others are getting launched in the Houston area.
I love it. I love it. I'm so proud that the March of Dimes stays pushing to make it known and to make all of us aware of those things that we forget or we bypass or we overlook. November 17th, if you guys aren't aware, is Premature Awareness Day. And sometimes I forget. My son was premature. 8 years down the road, I forget what I've gone through and what many other moms are still going through. So if you would tell us a little bit more about Prematurity Awareness Day, if I can say that right.
Yes, you got it. You got it almost exactly right. It's the whole month of November. Actually, it's Prematurity Awareness Month. November 17th is World Prematurity Day. It's the day around the world because premature birth isn't just unique to the US, as we all know. Women and babies around the world experience this. We have 15 million babies that are born prematurely every single year. And in this country, our rates of premature birth have been increasing now for the 5th year in a row. And when we look at babies of color, women of color, we know that women of color in Texas are 40% more likely to have a premature birth as compared to other women. And we know that those issues are even worse than national average all around Texas, and especially in counties like Harris County and other counties. So, what we are trying to do with World Prematurity Day is link arms with entities and people and healthcare providers and others all around the world to call out these issues, to raise awareness around these issues, and work within this country and with other countries as well to address the underlying causes of it. Why we do It Starts With Mom, Sky, is because when we look at premature birth, we can't solve it just in the 9 months of pregnancy. Right. It really, so much of premature birth actually goes back to the health of the mother even before she's pregnant, and then during pregnancy. And then we've got to deal with the mom after pregnancy, maybe in between her one pregnancy and the next one, right? To make sure that she's ready and her body's ready for the next pregnancy if she chooses to have one. So these are issues that are fundamental. It comes down to our health as women, advocating for our own health, advocating for our babies, advocating for our families. And who better to do that than women when we all come together? And when we say for once and for all, we demand what we have been calling for the March Times blanket change, comprehensive solutions that address fundamentally the health of all women and all babies in this country and around the world. And that's what this whole effort is really all about.
I love it. I love the fact that you also leave a door open for others to get in on that fight. Today, all sponsorships and gifts from today's events are benefiting the March of Dimes Birth Equity Initiative. Can you let us know about some more tools and resources that are available now?
Yeah, absolutely. I'm happy to. We use this month of November and all through the rest of the year to engage companies, to engage employers. We want to be that partner that helps many companies really provide the right kinds of support and solutions to their employees so that premature birth rates can decline in companies, that women have healthier pregnancies. That not only helps those women and those families, but guess what? It helps the companies too reduce their overall costs, and it's good for everybody. But we also want to make sure that women know that there are a ton of resources available. It Starts With Mom is really an effort to provide enhanced education and tools and information to women. Any woman can visit our website at any time at marchofdimes.org to get more information. If she's got questions, if she's got challenges. Right now, we're even expanding our ability to provide and connect women with telehealth services so that in Texas, for example, where we have many, many counties that don't have access to any obstetric services at all, if you're in a rural county, you can actually go to the March Times website and hopefully get connected with resources and healthcare providers. But certainly in Houston, there are some of the best health institutions in the entire world right in Houston. So we want to work with all of the healthcare providers there to make sure that we're doing as much as we can to reduce maternal and infant health poor outcomes, and that we address the inequities that exist right there in the Houston area. And for that, we're happy to be as broad and as strategic a partner as we can possibly be with any company or institution in the Houston area.
Absolutely. Now, this is a little off the cuff. I'm going to throw it at Stephanie and Regina really quickly before I give final words with you, with Stacy. Regina, Stephanie, I stepped up and became an advocate because. Give me one strong sentence to encourage anyone that's watching to do the same. I stepped up and became an advocate with March of Dimes because. Give us a power line.
I stepped up and became an advocate with March of Dimes because my child's life depended on it.
Wonderful. Stephanie?
Yeah, I stepped up and became an advocate of March of Dimes because we have to use our voice to make change. No one else will do it for us.
Absolutely. And I'm going to throw mine in there. I stepped up and started using my voice even more because my voice matters and I will be heard. Stacy, I'm going to throw it to you. What final words would you give viewers today on closing that health gap? What would you tell them today?
Absolutely. Boy, I feel like I just went to church. That was really inspiring. That was awesome. Listen, I think we can all agree on one thing, and that is that every woman matters, every baby matters. And I don't think any of us find it acceptable that any mom should go without the support she needs, that any baby doesn't have what they need to start their life as healthy as possible. That is something that I think is universal in terms of who we are as people. I know the community of Houston. I've got family there. My husband's from there. I know how people in Houston rally around a cause. And I know how much they care about the March of Dimes and our mission. I know how much they care about moms and babies. And so what I would say is that if we care about moms and babies, we need to care about all moms and babies. We need to recognize that this country has historically had inequities that we can overcome. We can actually solve this. The CDC has said that 6% of all maternal deaths are avoidable if we just do the right things, if we listen to women, if we listen to when they are expressing themselves, if we respond to their needs when they need it, if we don't ignore what they're saying is pain, or if they have symptoms that we are listening to and seeing, we can deal with these issues. We can see results. It does mean we need to come together as a community. And I'm really proud of how much momentum Houston has right now with this effort. And Sky, I want to thank you. And I want to thank Stephanie. I want to thank Regina for just being amazing leaders, because your voices matter and your voices make a huge difference. And when we bring all of our voices together, there's nothing that will stop us. So just thank you so much for doing this, and keep up the great work that all of you all are doing.
Absolutely. Thank you. I share the sentiment with Stacy, to you both, Regina and Stephanie. This goes on. This is just the start. This isn't the final word you'll hear from March of Dimes. And if you're watching today and you are about to have a baby, you're looking forward to it, you too can be a part. Know that this walk isn't just solo. There's resources out there. And I encourage you to go to the March of Dimes website, click the links to see how you can be a part. Right in the Facebook chat, there will be a link for you to connect and get more resources and stay along for the journey. Ladies, thank you again. I love the work that the March of Dimes is doing, and I'm really happy about the sponsors who understand how important this is. So really quickly, a special thank you to today's sponsors: Memorial Hermann Healthcare System, Cost Cutters, the Women's Hospital of Texas, JP Morgan Chase, Community Health Choice, and Wells Fargo. Our media sponsors: KPRC, Houston Public Media, Radio One. A thank you also to our implicit bias donors: Blue Cross and Blue Shield of Texas and Cigna. And lastly, thank you to our 50th anniversary sponsors: HEB, HCA Houston Healthcare, and Reliant Energy. Thank you. This is amazing, and it's even going to get even better. This is the start. Although we kicked it off last year, thanks to our Birth Equity Committee led by Lisa Holland Nelson and Chantel McWilliams and the entire committee, the journey continues. We thank you, ladies, for being at the forefront of this kickoff, and we welcome those who will join the fight, who will join us in making sure there is awareness around this, and that moms, it starts with moms, and we will continue the fight.